Oxytocin by Jessica Starkey. I am doing this for my advanced human physiology class at Ivy Tech Community College. So let's just jump right in. So, first off, we have oxytocin. What is oxytocin? So, oxytocin is indicated to produce or increase uterine contractions in antepartum and postpartum women. So, whether you have delivered a baby or whether you have not delivered yet and you're still waiting for labor, you may be given a oxytocin injection if they feel like that is necessary. Trade names or other names for oxytocin can be referred to as the generic name, which is Pitocin. And then the classification is a uterotonic agent, so it's going to stimulate the uterus to produce uterine contractions. What stimulates a release of natural oxytocin? So this is not talking about the IV administered oxytocin. This is the natural oxytocin. So for the most part, it's a love hormone. It's referred to as love hormone. So it's going to be associated with sex, childbirth, breastfeeding, and almost any form of social bonding or positive physical contact. And then on a study done with chimpanzees, it even found that sharing a meal will also release oxytocin naturally. Common triggers physically is going to be cuddling, kissing, hugging, holding hands, etc. And then social bonding would be talking, making eye contact, laughing, just having a good time. Sex is also a big one for release of oxytocin, breastfeeding, and childbirth that can also trigger oxytocin release naturally. So, oxytocin is a positive feedback hormone, and that is because the mechanism allows the release of a hormone when the trigger occurs. So, something positive is going to cause this hormone release in the body, and then once the other hormone causes an action in the body, such as a release of milk or labor contractions, that signal more production of oxytocin. So the feedback cycle kind of continues until the action such as childbirth, breastfeeding, hanging out with somebody is complete. So how is it regulated? So in spontaneous labor, meaning that labor starts on its own, oxytocin is naturally released in the body. And oxytocin is a naturally occurring hormone, and it's produced in the hypothalamus but secreted by the pituitary gland. And then if your body does not produce that oxytocin hormone, you might need a dosage of oxytocin to begin those uterine contractions. And then while some women require an IV dosage of oxytocin to start the laboring process, others can have spontaneous labor and not need the dosage whatsoever. So, like I said, the drug oxytocin initiates uterine contractions. So that effect of this drug in antepartum women whose fetuses are at risk. So oftentimes the doctor could recommend that you have a Pitocin induction if your baby is at higher risk of being in the womb versus being outside of the womb. And then there's not always this reason. It could also be if a pregnant woman is past her due date by several days, a physician may order a uterotonic agent to induce labor as well. So epidemiology, so not only is it given to antepartum women, it's also given to postpartum women. If they're experiencing some excessive bleeding, they may go ahead and administer some more Pitocin to kind of help that uterus contract and to stop that bleeding. So as we can see here, we can give oxytocin when the baby is in the womb, and we can also give it when the baby is outside of the womb. In a study did in 2016, approximately 30% of women had an induction, and then they also stated that the most commonly given form of an induction drug was Pitocin. Unfortunately, there are risk factors for both baby and the mother. So some other factors that mothers had reported after or during the oxytocin injection were excessive bleeding after childbirth due to those contractions, headache, blurred vision, and then some people also experience dizziness, some fast heart rate, confusion, and just overall just feeling foggy. I remember reading that mothers just kind of felt kind of droggy and just didn't really feel like themselves. And then baby, some risk factors for the baby, jaundice, so that would be like yellowing of the skin, some eye problems, seizure, and then slow or abnormal heart rate. So mom would have fast heart rate, baby has slow heart rate. So, what mechanisms fail in order to create a need for oxytocin injection? So, it is produced by the hypothalamus and secreted by the pituitary gland. When these mechanisms fail to produce enough of this hormone, a dosage will be given to the patient to get the oxytocin levels within normal range. Cellular pathology. So, in the hypothalamus, oxytocin is made, and it's made in magnocellular neurosecretory cells. And those are in the nuclei that are stored within the herring bodies at the axon terminals in the posterior pituitary. Like we said, it's made in the hypothalamus and then it's secreted through the posterior pituitary gland. It is then released in the blood from there from the posterior lobe of the pituitary gland. And these axons have not been ruled out as dendrites, have collaterals that innervate neurons in the nucleus accumbens, and that is a brain structure where oxytocin receptors are expressed. So all this happens like a process in the brain that goes from the hypothalamus to the posterior pituitary gland into the blood and then into where the receptors are expressed. Next up, the etiology. What makes oxytocin necessary during a pregnancy? So, women who are approaching 2 weeks past their due date, if your physician recommends getting oxytocin, pre-labor rupture of the amniotic sac, so lack of amniotic fluid within the amniotic sac would definitely be a reason. Fetal growth restriction, so if the baby just cannot grow anymore, or there's just some kind of restriction that's causing the baby to need to come out sooner. Diabetes and blood pressure issues. So gestational diabetes and preeclampsia can cause a need for an induction. Uterine infections, or I know like pyelonephritis, infection of the kidneys, can be harmful to the baby, so we want to get the baby out. And then RH issues, so mom has positive blood, baby has negative blood, mom has negative blood and baby has positive blood, just not, blood types don't match up. And then an incomplete abortion or miscarriage, so there's just some stuff still left in there, or the baby did not come out all the way. You would need to stimulate the uterus to kind of push that baby and all that leftover stuff out. So oxytocin is an oligopeptide hormone, and it contains 9 amino acyl residues, or in other words, it's a non-apeptide hormone. It is one of the only 2 hormones that are stored and released from the pituitary gland, but created in the hypothalamus. And it is specifically released from the paraventricular nucleus of the hypothalamus into the posterior pituitary gland for later use. So this specific part of the posterior pituitary gland that stores oxytocin is called the pars nervosa, and it's also referred to as the neural or posterior lobe of the pituitary gland. So most hormones will create a negative feedback loop after they are released, but oxytocin is very different, and it's one of the few that exhibit a positive feedback loop, that the release of oxytocin leads to actions that stimulate even more of a release of oxytocin. So it's kind of like this never-ending cycle. And it keeps going until the action is completed, so like childbirth, breastfeeding, etc. This feedback is comparable to an antidiuretic hormone such as like a vasopressin, and it is the second and the only other hormone that is stored and released from the posterior pituitary gland. So this exhibits a negative feedback loop and after release. So less of this hormone will be released after it exhibits its effects on the body. So after the goal is reached, the completion of a task, then it will be negative and then it will stop. How is it made? So Pitocin or oxytocin, the injection is a sterile, clear, colorless, aqueous solution of synthetic oxytocin for intravenous infusion, so meaning it would go in through IV, or intramuscular injection as a shot. So Pitocin is a non-apeptide found in pituitary extracts from mammals. The hormone is prepared synthetically to avoid possible contamination with vasopressin, antidiuretic hormone, and other small polypeptides in biological activity. Pitocin has the empirical formula of C43H66N12O12S2, and the molecular weight is 1007.19. How is oxytocin administered? So, all patients receiving an IV dosage or intramuscular doses of oxytocin must be under continuous observation by trained personnel. So, you would probably be in the hospital or a doctor's office, and it's important to have somebody there that can identify complications that are occurring and get treated for those. And then they also will go through a drip method, so it's an infusion, so it's going to be given over a period of time. You don't want to give too much or too little at one time because the effects will not be as great. And then for an induction, they will increase the dosage until the contraction pattern is met that they like, and they will slowly start to decrease the dosage in the same manner it was increased. And then accurate control of the rate of infusion, like I said, is essential and is best accomplished by a pump. Then lastly, oxytocin is a drug that increases uterine contractions. We already talked about that. It is a positive feedback hormone, so it relies positively on feedback from the body and is one of the few hormones that have positive feedback loops. It can be administered in women that have had babies and women that have yet to have their baby. It can be used to start contractions and can be used also to stop vaginal bleeding. Although there are risks for both mother and baby, I feel like it's important for a mother to kind of weigh the risks and benefits. And lastly, oxytocin is known as the love hormone. So I think that's awesome. I think that's definitely why it is released on positive feedback loops. Thank you.